today's video, we will be talking about vital signs.
Vital signs. Signs necessary to life, temperature, respiratory rate, pulse, and blood pressure. Used to evaluate a patient's condition. Temperature. A measure of the amount of heat below the skin and the subcutaneous tissues. Temperature can be broken down into 5 different terms. Fever, elevated body temperature. Febrile, with fever. Afebrile, without fever. Hypothermia, body temperature which is below the normal range. Hyperthermia, body temperature which is above the normal range. Pulse. Regular, recurrent expansion and contraction of an artery produced by waves of pressure caused when the heart beats. Sensation that can be felt when fingertips lightly compress an artery against an underlying bone. 5 terms related to pulse. Tachycardia, abnormally rapid heartbeat above 100 in adults. Bradycardia, abnormally slow heartbeat below 60 in adults. Thready pulse, weak and rapid pulse. Bounding pulse, unusually strong pulse. Arrhythmia, pulse with irregular rhythm. Respiration, exchange of gases between the atmosphere, blood, and cells. Respiration consists of 6 terms. Inhalation, the act of taking air into the lungs. Exhalation, the act of expelling air out of the lungs. Dyspnea, labored or difficult breathing. Apnea, absence of breathing. Tachypnea, excessively rapid breathing. Respiration, measurement consists of 1 inhalation and 1 exhalation. Blood pressure, the force that circulating blood exerts against artery walls as the heart contracts and relaxes. Blood pressure is measured in the units millimeters of mercury, mmHg, recorded as 2 separate pressures in fraction form. 5 terms related to blood pressure. Systolic pressure, the pressure created in the arteries when the heart contracts and forces blood out into circulation. This is the first blood pressure sound you will hear. Diastolic pressure, the pressure remaining in the arteries when the heart is relaxed. This is the last blood pressure sound you will hear. Here we can see systolic pressure that forces blood out into circulation, and diastolic pressure where the pressure remains inside. Perfusion, the flow of blood through tissues, providing them with oxygen and nutrients, and removing waste products. Hypotension, abnormally low blood pressure may cause insufficient perfusion of internal organs, which means bad blood flow in the organs. Hypertension, abnormally high blood pressure may cause rupture of the arteries and destruction of organs. Abbreviations: BP, blood pressure. DBP, diastolic blood pressure. F, Fahrenheit. P, pulse. R, respirations. T, temperature. mmHg, millimeters of mercury. RR, respiratory rate. SBP, systolic blood pressure. VS, vital signs. Obtaining vital signs. A patient's vital signs can be taken in many locations. This helps if the patient has some type of injury or any other indicator that may conclude in you having to use an alternate location, such as a missing arm. Now we will go over the anatomical location that the vital signs are commonly associated with, starting with temperature. Oral, inside of the patient's mouth, underneath their tongue. Rectal, inside of the patient's anus. Axillary, underneath the patient's armpit. Tympanic, inside the patient's ear. Anatomical locations of pulse. Here's all the possible locations where you can take the pulse on the body. Let's go more in depth. Carotid, up along the large carotid artery on either side of the neck. Brachial, found in the upper arm. Radial, known as the wrist pulse, and is also found on the lateral side of the patient's wrist, just above the crease. Femoral, found along the femoral artery in the patient's leg. popliteal, located behind the kneecap and can be palpated on the dorsal side of the patient's knee. Dorsalis pedis runs along the line between the first and second toe, and its pulse point is felt in the midfoot. Posterior tibial divides between the medial malleolus and heel into the lateral and medial plantar arteries. Anatomical location for respiratory. Watching the rise and fall of the chest cavity is the most accurate way to visually take note of the patient's respirations. Anatomical location of blood pressure. The blood pressure cuff should be positioned on the patient's upper arm, with the center of the bag covering the brachial artery. Anatomical location of pulse oximetry. Oxygen saturation is the ratio of the amount of oxygen present in the blood to the amount that could be carried, expressed as a percentage. The sensor should be placed on the patient's fingertip. A toe or distal foot can be used in infant patients.